Hello, everybody. My name's James. I'm a doctor by background. I'm the founder or co-founder of SomX. We're a communications and a creative agency. I'm delighted to be joined by Samira, the founder of Healthy Content, Sick Ideas, an influence marketing agency. Peter, who's a pediatrician and an influencer, known as Dr. Disney, so please address him as such. Valerie, who is head of digital health innovation for mid-sized countries at Daiichi Sankyo, and Marguerite, who is the commercial director at Newman. So this is the social media panel. So of course we've just been creating TikToks around the back of the stage, and Samira said we're only used to speaking in 15 seconds. So the fact that this is 40 minutes is it's going to be quite interesting to see if we can make it to the end of this, but we're going to do our best. So we're going to be talking about social media. We're going to talk about the fact it's a bit of a double-edged sword. There's a lot of positive things to come from social media, but there's also the negative too. So we're going to touch on all of that, all of the patient communities that have cropped up because of it, and again, the positives and the negatives. And yeah, some complicated things around regulation perhaps that Vishal, who's probably here somewhere, is trying to correct at YouTube with his health shelf and things like that. But yes, let's get into it. So I'm going to ask the panel, how do you think social media has positively changed the landscape of healthcare communications? We're going to start positive, get all the positivity out there. So Samira, I'm going to come to you. You've obviously got a personal journey with a health condition, and social media has helped you create a community around what you do. So yeah, why don't you tell us a little bit about it?
Yeah, so, oh wow, I'm so loud. I was diagnosed with multiple sclerosis 10 years ago, so I am also a patient. And after I got the diagnosis, I was basically left alone by my doctors. I think they had about 2 minutes to tell me the diagnosis. And that was it. And then I got like a big stack of pharma brochures with very happy people on them, where I was like, these people didn't just get a diagnosis, did they? Because I didn't look like that for sure. But as the years went by, my condition didn't get that bad as I had expected, because what I did in the beginning was Google, right? That's what we do. We jump on Google, and I thought, well, it's going to be 2 months and I'm going to be severely disabled and not being able to brush my own teeth anymore. But years later, nothing had happened. And I thought it can't really be the case that, and that was 2013, right? It can't be the case that we go on Google or we go on social media and all we find is like the worst case scenario. And being a 23-year-old woman back then, I mean, it was so scary, right? So I thought, okay, I'm going to jump on social media and create the account that I would have needed when I was diagnosed with MS. And that's what I did. So 2017, I kicked off my Instagram account about multiple sclerosis. And yeah, now it's going pretty good. I'm doing well health-wise as well. And to me, social media has provided community. To me, social media has provided connection with other patients. It has given me a stage to speak about what is important to me. And I continue to do that. And I really love it. It has become my mission in a way.
Awesome. Yeah, social media and healthcare, it's interesting, isn't it? Because we've got patients creating on social media, we've got clinicians now creating on social media, we've got brands creating on social media in healthcare. So it's becoming a really interesting place for so many different types of content. Marguerite, coming to you, with the work that you do at Newman, what social media's managed to do is, for brands, is to reach people with lots of different conditions and educate them and help them. What's been your experience doing this with Newman?
Yeah, exactly. It's been, sorry, the microphone's very loud. It's been hugely powerful in helping to destigmatize certain conditions and certain diseases, particularly in the context of obesity. And Newman is a fully integrated digital healthcare provider, helping patients to treat them with obesity. And what's been really important is there's been historically a preconception that obesity can be someone's fault, and that it is a factor of people's environments. But we now know that up to 70% of the reason why people might be living with obesity could be due to their epigenetics. And so social media has been an incredibly powerful tool in destigmatizing that condition. And we've actually seen a huge rise in adoption of certain treatments that might be very beneficial to patients who are, in this instance, living with obesity. I think maybe 2 years ago, it was pretty unthinkable that people might be using at scale medication to help them with weight management. And now we've seen through the rise of GLP-1s that there was a recent study launched in May that 1 in 8 adults in the US has taken GLP-1s to help them manage their weight. And that, in part, is due to a proliferation on social media, destigmatizing the disease, and also normalizing certain treatments that might be beneficial for certain patients.
Yeah, I find it interesting that what we've seen in communicating health information, it's historically been quite academic, hasn't it? You get academic studies that come out and say some things, and it's up to, I guess, people reading those research papers to then understand it, and for some people to then relay that to the public, or at least it goes through to a clinician or a health system, and then a new drug might be prescribed or something like that. Social media is kind of shortcutting this, and I guess
I have one thing to say just on that comment. One thing that I've learned as a clinician, as a pediatrician, is especially when it comes to obesity, I'm grateful that we're a lot more mindful about the language that we're using, but I've seen so many stories about like, oh, my doctor when I was 8 years old called me fat to my face. And I've been horrified of the things that I see our colleagues doing in offices that are private but now have been publicized and people can share their stories. So I've been able to rework how I talk about obesity and weight management, and not talking about the number, but rather lifestyle choices. And we're talking about healthy lifestyle and for the family. It's not the child. Don't ostracize them. And then my colleagues can be in the comment section saying, oh, this was helpful, or other people sharing their trauma. And it's like a really wonderful environment for people to talk about the positives, but also the negatives of healthcare and its complexities.
You know, I joked at the start about the fact that we have to speak in these 15-second blocks, and we have to, now we're forced to be succinct and engaging and entertaining. And I sort of joke about it, but it has forced us to do that somewhat in healthcare. And for yourself as a clinician, is it a skill? Is it a burden?
I think that, well, I studied acting, so I have a leg up in that I trained in this, and so I know how to communicate, actively listen. This is like what I do as a theater actor. And when I'm in the office, I'm trying to connect with the person in front of me. Doing the TikToks, YouTube, social media stuff has allowed me to reduce the jargon that we were just talking about and make it accessible for someone and hear my words back to me, because I also edit my own stuff, and so I can hear it and be like, that was bad, let me redo it. And so social media has primed me, but other doctors don't have that opportunity, and I think we'll get into it later, but who has the responsibility to train people, especially clinicians, to be able to facilitate these conversations in the office, on social media, because social media sort of removes all of the obstacles to care, and we can reach people where they are, in their hands, in their pockets, and then if they're concerned, invite them to go see their doctor, which hopefully they'll then have a good experience with the doctor, but who knows.
So I said we talk about the positives first to get that out there, and there are more positives to come maybe, but there are also plenty of challenges. And Valerie, I want to come to you next. So let's talk about, I guess, the comment sections. They're not great sometimes, and I imagine, you know, for anyone in pharma or regulatory in the audience, you might start cringing when we say that patients might discuss medication side effects. Someone might propose a rogue treatment. They might put even a YouTube video of its own out about these things. It's not always a good place, is it, social media?
Yes, so for your information, so I'm a rare disease patient. I have cystic fibrosis. And on the one hand, social media was really like bringing this rare disease community together, especially for cystic fibrosis. Patients can't meet in person because it's contagious, like you can exchange viruses or bacteria. So this was like so supportive, having the social media platforms where patients could start communicating, and you could find that other rare disease patient, because in the end it's 1 in 10,000. So it was really instrumental for us to connect with each other. On the other hand, when I'm in those Facebook groups of CF patients, you see a lot of side effects management, patients giving suggestions to other patients like, oh, I had a lot of gain in weight when taking that specific drug. So what I did, I reduced my dosage from 2 pills per day to 1 pill per day. And then you see that other patients are reacting on this. Oh, I do that also, but I don't take the morning dose. I take only the evening dose because then I feel I have less depression side effect. So this is kind of an area where patients sometimes feel they can't discuss always those aspects with their physician, because physicians say like, oh, a gain in weight, it doesn't mean anything, like your lung health is improving. Why do you care about your weight? So sometimes patients feel they are not heard by their professional, and then these Facebook groups are a way for them to feel heard, but also with the danger that patients start to do self-medication, start to adapt their dosage, and do not communicate that with their physician. So that could be a side effect or a negative aspect as well.
Samira, do you see that in your content? Do you ever feel the need to jump in and start moderating?
Yeah, well, of course, many people discuss that on social media. They do send me a lot of messages asking me for advice as well, and I'm by no means a healthcare professional, right? I'm a content creator, which is very different. So what I do is I send them to the doctor when they ask me, could this be an MS symptom? But already that really helps people sometimes. Like just me saying, go to your doctor, discuss it there, is like, okay, yeah, I'm going to do it. I didn't even think of that. So I'm very happy to step in at this point. But obviously, it's not regulated at all. And I mean, this is, I think, one of the biggest dangers as well, right? Because people jump in there and they take what they read at face value, and they might just like start to like tweak their treatment or stuff like that. And it's obviously something, that we have to be very mindful of. It's a big responsibility, really, that comes with being on social media, and I'm kind of providing the space for the people to talk in the comment section, but I also feel it is my responsibility to moderate that a little bit. And if I see, for example, somebody reporting a side effect of a drug, I'm from Germany, right? So we have like a pharmacovigilance page, and I send them the link, and I will be like, please report it. I'm not obliged to do this, but I think it is my obligation, just because I also work in the industry to report side effects, for example.
Yeah.
And you were saying that you also, like, if they saw you eating cucumbers or something like that, they would take your word as like.
Yeah. So actually, like sometimes people would come to me and be like, so 3 years ago, I saw a reel of you where you said you weren't eating like unpeeled cucumbers anymore. I don't even remember having said that 3 years ago. I don't know what was going on in my head. But people really take this as a suggestion from me to them, you should never eat unpeeled cucumbers, which was by no means a suggestion at all, and which also is outdated now. So I really have to be mindful of what I put out there. For example, when I show myself exercising, I'm an MS patient who isn't very sick every day. But I don't want to set the measurement of this is how much you have to exercise to be a good patient or to be living healthily. It's just my personal exercise routine, right?
It's interesting, the line between what is a personal insight and what is professional advice, particularly if you're a clinician, right? If you've got people hanging off every word, and you don't necessarily have a regulator out there coming for you, there'll be good actors, pun intended, and there'll be not so good actors. How do you think about that?
So the way I construct content is I will end with what is the goal I want them to take away from this video? Asthma education, lifestyle choices, adverse childhood experiences surveys, which is like this wonderful thing. If you've not heard of it, please look into it. It's how we are affected as children, impacting the grown-ups we become, and we are at higher risk for disease and depression. It's fascinating. It's a 10-question questionnaire, and I will think about what the goal is and then construct a story backwards and try to make sure that the goal is education. That's where I'm coming from. I'm not trying to say anything woo-woo or anything mysterious. It's really just like, this is what we do in the office. I'm just bringing it to social media so that parents can hear it. If your kid is coughing and you're not able to solve it, they might have asthma. If you've not heard of that term, let me teach you what that is, and if you are concerned, go to your doctor. And I've had so many parents who've messaged saying similar things like, oh, I now want to go to the doctor, or you've inspired me to go see my pediatrician. Or things like, I've gotten messages like, you've saved my child. I went to the pediatrician, they didn't believe me, but because I used the term you used in your video, which was post-tussive emesis, which just means you cough so much you make yourself vomit, they did some studies and found that my child had raging pneumonia and was hospitalized for a week. And I didn't even think to tell you, but I had to come and tell you that you saved my child through social media. And like, that's such a blessing to me because I could go home and just sleep and do nothing with my life, but I think that what I do in the office is one-on-one patient care, but we do have a responsibility with macro-level changes, and I feel we're obligated, to use that word, to capitalize on social media and to meet patients where they are on social media, because it takes so much to get a family into the office. And then if they're late, all the fees that they incur, or they might not be seen, or the doctor's already rushed, or they're not actually listening to them. Healthcare is a hopeful thing. I believe we can make it better. I think that's why we're all at a health conference. But it's broken, and it needs its own like revitalization and medication to fix it.
And it's interesting how you all actually take a personal responsibility, and we'll come to that a little bit later. The next thing I wanted to ask is the algorithm. Everyone talks about the algorithm. It can be a force for good, it can be a force for bad. The algorithm, I'm sure, has benefited everyone on here at one point, either as a creator or a consumer of content. You will have been fed something highly relevant to you, highly useful to you. You will have made a positive behavior change for your health. But I'm sure also, as creators particularly, you have to balance that against, you have to create what's popular. And that can be a difficult balance, right?
Yes. The algorithm is mysterious. I don't really know how to solve it, but I think if you keep your passion in place, people will sense the genuine nature of your content. And then also the second thing is, what is your messaging? If it's all self-serving, then your audience will know that. So the question I now have to ask myself is not just what do I want to create, but what does my audience want to see? And then fill that void. And then also with trends and stuff, since I'm a pediatrician, I kind of carved out a really nice space for myself because I could talk about Inside Out 2, which is a new movie that came out. It's about mental health. And so I could use that as a bridge to talk about nuanced pediatric stuff. In pharmaceutical companies, I'm sure there are wonderful people who help design content in that way, but the algorithm is really just like hashtag cystic fibrosis, hashtag Crohn's disease, and you can find similar content. Does it always work? Unclear, but it's an always shifting thing.
And on that, there's a great opportunity to educate patients on certain diseases or treatment areas or lifestyle changes that are relevant to them by actually using some of the techniques from other industries. So you talked about making it engaging, making it popular. We can actually use certain like viral trends. I don't know if anyone's seen on social media, like Post-its lit on fire to grab people's attentions. All of that stuff, all those hooks, are actually really, really key to bring in patients and to help them to take actions on their health. So there is a way to make content popular and accurate as well at the same time.
I think we can still use some tips on how to make content engaging. So for the CF community, we have a European registry where we have consent for 55,000 people who provide consent to use their data in the CF registry. And as a registry, we feel responsible to also feed back to those patients what happens to their data. So there are a lot of research articles published based on those patient data, and we want to bring them back, but not via the typical journals, but via also social media. And it's really a struggle how to bring those scientific articles and scientific content back to the lay patient in an engaging way, because if you just publish on your social media the paper that was published based on their data, it's not engaging at all. We get 4 likes, and they are not even the patients. So how do you bring scientific content in a way? And then we try to ask the physicians, can you maybe make a movie where you explain the research to the patient? The physicians don't want to do this. They don't feel comfortable speaking for a camera on a scientific article. They are so used to this really well written down, complete, comprehensive document that they don't feel comfortable in social media. So this is a struggle, like how do we bring back the insights that we gain thanks to patient data to the patient? So I think there we can still improve in how to do that.
Not everyone's an actor.
Say it again?
Not everyone's an actor.
Not everyone's an actor, but I think the responsibility is on medical education, that you have every single future doctor in your room sitting in, listening to lectures upon lectures upon lectures. I had, in all of my medical school training, 4 hours on nutrition health. That's it. And nothing on communication, nothing on public health, nothing on public speaking. And I designed a class for my colleague because I was like, the hardest class for me is biochemistry. And they're like, what? The hardest class for us is the patient-centered one. I was like, you mean the job that we're doing? They're like, yeah, but no one taught us to talk to people. So I designed this curriculum to teach them how to be better listeners, active in the patient room, and I called it medical improv, and you teach them how to be better doctors through theater games, and they all loved it because it was the first time in their life that someone taught them how to make eye contact. You know, communication, it's this wonderful thing, but it's not just the content, it's not just the jargon. You know, you could say erythema or diaphoresis, but those are just fancy words that doctors use that mean redness or sweating. But the doctor's they're all trained to talk like that. No one's taught them to distill what they know. And it's really fascinating how uncomfortable they are. So I can imagine they would not have the training to be able to disseminate information to the masses, let alone in a one-on-one patient room, and then all the hurdles and obstacles they have on themselves too. But it's on medical education because they need to acknowledge what the future of the world is. Everyone is on social media now. Everyone is using technology. They need to equip doctors to be able to have these conversations because God forbid there's like a school shooting. We have a lot of them in America. Who does the news bring on? They bring on a pediatrician or a psychiatrist. But do they have any training to be on camera? No.
Samira.
Yeah, and I also think like one side is on the HCPs making that kind of communication on social media, but the other one is actually on-patient content creators. So I think we kind of like go together in the way that we communicate, because obviously I'm not trained to like communicate studies or whatever, but I am trained in saying how can you improve your life with everything else that goes on in your life, right? What effect does your psyche have? What effect does your sleep routine have? What effect do your stress levels have? So I think here the communication can really well go together between HCPs, patient content creators, and even the pharmaceutical industry, who hopefully talks to patients before they put any communication out, because if they didn't, as a patient, I can say you notice. It's usually not that good.
Right, and you were saying something fascinating before where you were like, versus the surface level superficial content, you as someone who's been experienced with a chronic illness, you want the research, you want like the more detailed information, which was fascinating for me because I always think about making it massively accepted, and you want like the hardcore details and information from research studies.
I mean, we become experts in our own disease, right? So of course at the beginning of a diagnosis, yes, I need easy information, easy digestible, bits. But of course, after 10 years, I mean, I don't need like a breakdown of the most common knowledge about the illness. I want the details and I want to go deep. So it could be really nice to provide both of these options.
Right. I think one thing I'm hearing is that what might be really important here is recognition of this as a discipline, recognition that this is a powerful vehicle to exchange information with certain patient groups, to educate the public at large. I guess, Valerie, what do you think in terms of, is it then important to be more deliberate about creating a community with pharma companies and patient creators and content creators that might be physicians or indeed brands, Marguerite? Should we be more deliberate about these communities and actually give a more sort of official voice?
Yeah, so those communities exist. I don't know if patients would be happy if pharma was also part of the community, but the information that is exchanged among those patients in those community is of course super valuable for pharma, for healthcare professionals, because we in our industry, we are always sitting around the table thinking, how can we bring value to our patients? What could we do? just go to those social media platforms. Yesterday evening I thought I will get all the comments of this Facebook group, and I put it in a GPT-4 model, and I just asked some questions like, what are the 3 unmet needs for CF? And it was amazing what came out, and it is really low-hanging fruit. It was, for example, like the main question was on guidelines on how to use the drug for young children. So apparently there is not enough information on that specific drug and the safety for young children. Wow, there you have it, like an unmet need, low-hanging fruit that you as a company can immediately solve. So I think the platforms exist, patients are putting information out there, and it's also just about mining that information and mining the data and trying to act upon it and to create value for your community and for your patients. But of course, it's a bit sensitive because as a patient, you think it's kind of a protected environment, patients among patients. And of course, the idea that industry would watch and use data, like, so there should be some transparency on that as well, that you know as a patient that the data is open for broader than only patients.
How do we make sure it's all accurate? There's a big question for you. You guys are the good actors, I'd hope, given that you're here. You obviously create high quality, accurate medical information. And actually, just to raise the point, that actually might not be that accurate in 5 years or even 12 months. That might actually change. So do you need to audit your own content and maybe take some of that down? Otherwise, you've got people contacting you in 10 years asking you about cucumbers.
Right.
It's interesting, right?
And I think it's exactly as you say, we need to constantly be looking at the content that we're sharing to make sure that it is accurate, working with experts to make sure that the information that we're providing is spot on and up to date. In the UK, we are regulated by the Advertising Standards Authority and by the MHRA, which means that any information that we share needs to and is 100% accurate. But of course, as our understanding of certain diseases develop, then we will need to go back and reassess how we're potentially communicating certain things. And that is a responsibility that we need to take on.
Yeah, there are some wonderful things that the companies are doing. So YouTube Health just put out a wonderful banner that comes across if you are a licensed professional, and you can apply to get that on your channel so that people who are watching know. But you bring up a great point, like what if something I did say as a professional is now outdated? Then it is on me to just be mindful of all the things I've talked about. But it's really cool to talk about them online, even if they do eventually become outdated, because to go back to the ACEs questionnaire, which is the Adverse Childhood Experiences questionnaire, I'm saying it so many times because you have to do it, it's going to blow your mind. That questionnaire asks some really poignant questions about childhood adverse experiences, and they ask things about, like, have you ever witnessed a violence in your home against your mother or your grandmother, or have you ever had your parents separated? And then people who commented said things like, this needs to be updated. They told me it needs to be updated because what if your father was the one who was mistreated? Or what if your parents separated but it was a good thing because it was hostile when they were together? Or what if you lost a parent? That's not even in the questionnaire. And I thought as a provider, oh, this is space for us to change how we practice from the population because they saw the holes in it. So I do think that it's like a give and exchange model that we have. We just have to be using it more thoughtfully and obviously being mindful of misinformation, because anyone can put anything out there and put hashtag illness and then it will explode. And similarly with viral trends, there are people who do things, the prefrontal cortex is not fully developed until you're like mid-20s, 30s, and that helps with impulse control. And so we've seen things when it comes to pediatrics, kids who do like the Tide Pod challenge. I don't know if that came all the way here to Europe, but kids were ingesting laundry detergent pods and ending up in the emergency room because it was a viral trend and it looks like candy. And then there's like the cinnamon challenge where they tried to see how big of a scoop of cinnamon, and they're like landing in the emergency room and all these doctors are like, what the heck? Why are all these kids like suddenly swallowing laundry detergent? And so they have to call the poison control, and it isn't until someone finally goes on social media and is like, oh, here it is. It was a hashtag trend.
Yeah.
So I think we have to be involved in many ways.
Yeah, and it's a problem with the model, isn't it? Because the problem with the cinnamon challenge is that it was dangerous, but some of those videos were hilarious.
Right.
And that's incredible for content. It's
Right.
incredible for views.
You go viral.
You go viral. You get everything that you want as the individual. Your
Right.
ego is fed. All the rest of it. And that is a bit of a challenge because the right videos don't always get the reach the wrong videos can. I know, Samira, you had frustrations around one of your videos showing extreme emotion being the most popular one, and it's like,
Yeah, so usually my content is quite positive, and I'm really trying to empower the patients that follow me and give them the tools to live as well as possible with their multiple sclerosis or other chronic disease. But I have bad days as well, right? I'm a human and I'm chronically ill as well. So I put up one reel where I was crying. I don't usually do that, but I just felt like it in that moment because everything is so positive that I'm like, okay, I have to show also the bad days because I was getting a lot of backlash for being too positive. So I put a reel up of me crying and it went viral. So apparently, it must have broken out of my little bubble and really reached like such a big audience. People were just like sucked in by seeing a woman crying on the internet. I don't even know if they read the text. Yeah. But something of that spiked emotions. I do want to touch on something that you were just talking about, like how we can create safe information on social media. And I do think it's also about how can we use, as a user of social media, use it safely. And I wrote down a sentence today in my book, which is modern health literacy doesn't work without social media literacy. We need to know how to use social media and how to distinguish between something that is absurd, like eating laundry detergent, and something that is actually valuable, like good content. And there is a responsibility for us as well. Maybe not if you're 13, okay, right. But from a certain age, we have to ask ourselves and use our brains a little bit.
So the obvious question for me after that is then, do you guys think, I'll ask the clinician last, do you guys think that healthcare professionals should all be creating content? Is that the modern clinician orator? Over time, clinicians have been orators of information and people have looked to them and they have, talked into groups to bring positivity or at least bring positive health information and correct health information. And we've seen Public Health and Public Health England disappear. And does the NHS budget stretch to prevention as much as we want it to? Probably not. There's a lot that you guys are doing there. But do you think that is the role of clinicians then? Is that what clinicians should be doing? Should there be a Royal College of Healthcare Content Creation?
Social media.
Yeah, Royal College of Social Media, yeah.
I'm not sure about the social media. I think the goal of the physician is to support your patient in the best way possible, in a holistic way. So I'm not sure if the physician needs to create content on social media, but what I think is that support the patient in the best way could mean that you also support your patient with digital tools, meaning that if you have an app and patients can ask questions, that you as a physician have a team, you surround yourself with a team to provide the safe and accurate answers for your patients. And I think AI in the future can probably take over a lot of this, but then I still think it's the responsibility of the clinician to validate the AI answers and to make sure that the AI tools are really safe and accurate to use. So presence on social media, I'm not sure if it really is part or obliged for every physician, but helping patients beyond the in-hospital consultations and also serving as responsible for AI tools in their specific disease areas, I think yes.
Yeah, you're right. It doesn't have to be through social media, does it? But actually, there is still something where you're kind of saying, well, we can still expect clinicians to perhaps do more than they are doing just outside the consultation. Now, that can be presenting to a room of 50 using modern communication skill that perhaps have come from social media, being succinct, being entertaining, being engaging. But yeah, you're right. It doesn't necessarily have to mean an Instagram profile, does it? What do you guys think?
I would agree. I think that it's 100% necessary, and it's what patients want, is to be able to talk to physicians and clinicians when they need to, and we need to be able to have the tools to facilitate that. And at Newman we do, and we see huge benefits in terms of patient outcomes. But the other point I think that you raised is it is important for clinicians who do want to use social media as a platform to be able to provide them with the right training and the skill set to be able to use that, because it is hugely powerful and a direct channel to patients.
Peter?
The answer is, do I think every clinician or healthcare provider has something important to say? Absolutely. Should they all do it on social media? No. But should they have the training for it? Yes. And the reason why is because everyone will have to communicate with other people. That's the basis of our whole profession. You learn how to present patients. You learn how to communicate with patients. And communication is 55% body language, 38% vocal inflection, and only 7% content. And what we're trained on is the 7% content, which is the lowest yield. And there are some healthcare professionals who are skilled and have a passion for research. That is not necessarily my area, but that they should want to explore that. But everyone should have the toolkit should they want to enter into the world of social media, and it should not be as stigmatized as it is.
Awesome. We're coming to the end of our panel. If anyone's got any questions, you can submit them through Slido, I believe, or if you've got your hand up and you want to just shout them out. Do you want to just shout out a question?
We're close enough, we can hear you.
Say it nice and loud so we can all hear you.
There's a spectrum, right?
Yeah. So healthcare is siloed. We can only see a doctor for one thing. That's the problem. What's the solution? Are creators the solution to that?
I think creators can start the conversation, because I've seen in the comments section people saying I have the same illness but I presented differently, or my child had autism and they had all these different symptoms. So I think it is wonderful that we can see the full gamut through social media, because people will chime in with their personal experiences that you won't get in with a private one-on-one physician-patient interaction.
Yeah, I also want to touch on that. I think being ill, as you said, you also have your own history. Being ill doesn't only mean my nervous system doesn't work the way it should, or I have pain in this limb. Being ill also means loneliness. Being ill means being desperate. Being ill means being sad. So there's like so many emotions that come with being ill. And I think especially patient content creators who put themselves out there are such an important harbor for those emotions that have nowhere to go, because your doctor has 4 minutes and your doctor will prescribe something and maybe ask, how's your digestion? And that's how far it goes. But how do you feel? Are you sad? Are you desperate? Are you lonely? This is stuff that doesn't get talked about. And it does in our community with patient content creators.
And I think that's where it's super important to look holistically at a patient's needs. They might be presenting with one thing, but it's incredibly important to diagnose them holistically and to see, is it something to do with their lifestyle? Is it other factors? And only by having proper diagnostics are we then able to holistically treat the patient.
I'll ask one more question before we wrap up, so you've got 1 minute and 10 seconds. What is something that makes you optimistic about where we're going with social media and healthcare?
I find it amazing that you can learn, especially again, rare diseases. I never had contact with other patients, so I was solely dependent on my healthcare professional. And there was no room for the holistic approach. So it's so exciting as a patient to learn from all the expertise and all the experiences from other people. And yesterday I was here at the Congress and I talked to someone randomly from the US and I was mentioning about this panel and about patient communities, and he was saying, oh, 10 years ago I started a community for cystic fibrosis, and it was targeting mothers with newborns with CF. And he connected those moms with the newborn to moms who had already like a grown-up child with CF. Oh. And it was so empowering, because if you get this diagnosis from your little baby with a life-threatening disease, and you could speak to a mother of a 5-year-old who is doing quite well, like, it is transformative for people. So the power of social media and the way it can connect across the world is amazing. So, yeah.
I think that's a beautiful note to end on. Thank you so much to my panelists, and thank you all for coming.